Dear students, Model 3, Dermatoglyphics, Inheritance Pattern, Clinical Applications, Advantages and Limitations. The main objectives of this episode are to know the inheritance pattern, to know about clinical application of dermatoglyphics, to know about its advantages and to know about the limitation. Fingerprints provide personal identification available to court and police. This became a powerful tool that the patterns of ridge skin, which are unique, immutable and universal. The fingerprints can easily leave a print on any kind of object handled with bare hands. There are studies to understand the detection techniques and operational strategy used for fingerprints. It forms definite patterns that appear to have a general resemblance in shape and design. This has allowed the fingerprint pioneers to devise systems of classification for fingerprint patterns and also allows the practical use of extensive collections of prints that can be filed according to a definite scheme. The analysis of dermatoglyphics pattern is now beginning to prove itself as a convenient window for diagnosing a suspected genetic condition. Sir Francis Galton, with his extensive research, demonstrated the hereditary significance of fingerprints and biological variations of different racial groups. It has a considerable influence on lifestyle, habits and the role of diet. It is often noticed that several individuals with these habits do not develop pre-malignant disorders. Fingerprint analysis such as ATD angle has been in use for selecting many athletes in China, Taiwan, Malaysia, Japan and Russia. If the ATD angle is less than 35 degree, give clues for the potentiality of a person as a born athlete, sharp observer and agile task performer. If the angle is more than 46 degree and above, is considered as a low learner. Several countries like US, Japan and Taiwan have also applied fingerprint as a non-invasive method to diagnose congenital disorders, genetic abnormalities and educational field to some extent. Our fingerprints are a unique and powerful tool in the diagnosis of psychological, medical and genetic conditions. Fingerprints become a predictor of the person's identity. Example, Aadhaar card, Indian identity card. Hence, in this episode, the following aspects are going to be emphasized. A. Inheritance pattern. B. Clinical applications. C. Other applications. D. Advantages and E. Limitations. The fingerprint is unique for an individual because epidermal ridges are genetically determined and their pattern remains constant throughout life. these patterns established during the fetal development stage, they follow a polygenic pattern of inheritance. Dermatoglyphics pattern diversification also reflects the genetic diversity of individuals. There are reports that many oral shaped fingerprints of a husband are similar to his wife. This observation suggests that the number of oral shaped fingerprints of a person will influence his or her selection of a spouse. The homolateral differences in monozygotic twin pairs have well documented in the literature. To demonstrate heritable character in configurations are to be regarded as manifestation of the inheritance of particular fetal contours. The ridge count is an inherited character. The variation in the ridge count from finger to finger is also under genetic control. Non-genetic factors may also influence the inheritance of dermatoglyphics patterns. In 1967, Gibbs reported on the inheritance of dermatoglyphics. He also emphasized that individuals may be born without fingerprints, in which case tips of fingers are smooth. He also advocated on medical uses of dermatoglyphics to correlate chromosomal aberrations and environmental infections with fingerprint abnormalities. In one of the studies of neonates with low birth weight showed a high frequency of simian crease, both typical and transitional types. The study of dermatoglyphics in a group of low birth weight infants showed that intrauterine disturbances were leading to cause unusual dermatoglyphics. The study was supported by other studies that increased the incidence of prematurity among neonates with a single transverse palmar crease. Many investigators attempted to bring the correlation of the dermatoglyphics to many complex diseases. Some of them are as follows. Dermatoglyphics in diabetes mellitus. Some studies have reported that dermatoglyphics play a significant role in the diagnosis of diabetes mellitus. In type 1 diabetes, patients show a marked reduction in loops and a notable increase in whorls and arches. In type 2 diabetes, patients show a decrease in ulnar loops and an increase in the frequency of whorls. However, no significant changes in radial loops. Males have fewer arches in the right hand when compared to females on the left hand. Kenner's syndrome. This is the infantile autism caused by psychological and neurological disorders. This is observed around 30 months of age with mental retardation, with epilepsy, hearing loss, dyslexia and Martin-Bell syndrome. There are reports of digital dermatoglyphics which show fewer loops and the high frequency of arches, while the arches of the first, fourth and fifth fingers of the left hand show higher frequency. There is a noticeable increase in ulnar loops. palmar dermatoglyphic distortions are common in the left palm. Hypoparathyroidism, the decreased function of parathyroid hormone causes a reduction in circulating parathyroid hormones, hypocalcemia and hyperphosphatemia. It is characterized by short, broad bands and increased arch patterns. Klinefelter syndrome. Generally, it is seen that on digit 1, excess of arches, few orals, on digit 2, more ulnar lobes, lower ridge counts for the orals and loops as compared with the controls, and significant reduction of the total finger ridge counts. Cray-Doo chart, a single transverse palmar creases and in 90% excess of arch on fingertips are usually observed. Congenital blindness, abnormal triradius and excess of arches on fingertips are reported. Trisomy 13. The most prominent features are single transverse palmar crease and 60% excess of arches on fingertips. Trisomy 18. The most prominent features are single transverse palmar creases in 30% and around 6 to 10 arches on fingertips. Trisomy 21, that is Down syndrome. Fingerprint patterns are with a single transverse palmar crease, which is called simian line, in 50% of the patients, and ulnar loops, a significant ATD angle patterns in the hypothenar and interdigital areas. The lower ridge counts along digital midlines, especially a little fingers, are usually seen in Down syndrome children. There are reports that fingerprint patterns can be used to determine correlations with congenital heart defects in individuals with Down syndrome. In Turner syndrome, predominance of oral is reported. Schizophrenia, generally AB ridge counts are lower than in controls. Celiac disease, in 1997, Tehan and his co-workers reported that increased frequency of orals and decreased frequency of ulnar lobe in the dermatoglyphics pattern in celiac disease. Automated fingerprint identification system is used for verifying human identity in the post-mortem remains. Thus, dermatoglyphics analysis can help in early detection of patients with susceptibility to diseases. 1. Biometry. The use of fingerprint recognition is one of the most prevalent forms of this innovative technology. In its simplest way, the scanner reads each employee's unique fingerprint whenever it is time to clock in or out. Therefore, the biometric fingerprint time clock has the following advantages: to detect a person based on their makeup. Employers will have confidence that they are tracking each employee's time and attendance accurately, prevent buddy punching practices which are illegal and has cost many employers millions in financial losses each year. Accuracy in the time management of the employee, whereas in the old method tremendous amount of work hours are lost because each employee wastes at least 20 minutes per day. This enables employers to monitor employees working in remote places even if they are halfway around the world. Improve employee job satisfaction where using the accurate attendance information captured, they can reward employees accordingly. Employees feel better about their job and work better because biometrics removes barriers such as time theft and raises productivity rates. Raise company profits by using biometrics for time and attendance allows companies to attain the highest levels of productivity. This helps employee accountability for time management with an audit trail. It has tremendous accuracy in identifying who is late and who takes frequent or extended breaks. Integrate with current system where the flexibility of a fingerprint time clock allows it to work well alone and swipe cards. Biometric fingerprint technology was designed to precisely track employees based on individual character traits that cannot be duplicated. Considering the many benefits of implementing this cost saving system into the employee time and attendance function, employers have very reason to embrace biometric time clock fully. 2. To identify criminals. But in individuals, the fingerprints are not the same. In crime scenes, this method has significant applications. To improve security, it helps to improve the security such that only authenticated person can enter the security area and not any other members. This is by the use of multispectral sensors. This is a piece of excellent news for construction companies. This technology works securely and accurately in real time. In grocery stores, to automatically recognize and bill a registered user's credit card or debit card. The fingerprints also helps to analyze biochemical traces in sweat found along the ridges of the fingerprint, and those trace chemicals can quickly within 30 seconds reveal that the cocaine, opiate, marijuana or other drugs are ingested. Left-handedness is developed genetically. Left-handers have a high risk of developing schizophrenia. Left-handers have more radial lobe. Dermatoglyphics analysis might help the parents encourage the child to develop their advantageous field and reinforce the child weak field and provide a suitable learning method and enable children to learn effectively. For students, it helps to choose an appropriate learning style and technique as well as helps to select a suitable area of development depending on one's strength. Comprehensive. For any adults, this helps to understand our strong and weak fields fully as well as supports to know our most suitable learning style. In the corporate field, this helps to manage human resources and customer management more effectively as well as helps to reduce operating cost and increase corporate values. Objectivity. Unbiased towards the cultural background, results are not affected by environment, health or emotional factors. 7. Stability. Reliable genetic information as fingerprints never change and need only to done once in a lifetime. There is no age limit. Simple, convenient, more adverse effects not comprising of any questions whatever so. Someone can access our smartphone forcibly, making us unlock our smartphone against our will. This is easy to bypass and create a lot of problems. Loss of the lands may create a situation or force you to unlock your smartphone. When you are hacked, you can change the password, but if your fingerprint is compromised, how would you change or update that? That would be impossible and frustrating. New fingerprint scanners can reveal drug use and other information, but they also raise complex civil rights questions. To conclude, fingerprints are not changed throughout life, even after death. Variations are also present in patterns of fingerprints related to various pathological conditions. Now, fingerprints have proved to be a most rapid, reliable and cost-effective means by which to identify unknown deceased individuals, especially in a mass disaster setting. The identification of remains through fingerprints accomplishes the most important and challenging mission of the forensic identification operation. Many advanced technologies in dermatoglyphics detection help to utilize in multiple fields. Thank you.